On today's Healthier Me, new research says long-term use of acid reflux drugs may heighten your risk of type 2 diabetes. The study had data from over 200,000 adults. It showed those who regularly use proton pump inhibitors like Prilosec and Nexium were 24% more likely to develop type 2 diabetes. Users of H2 blockers like Pepcid and Zantac had a 14% increased risk. Experts say people taking heartburn drugs for 2 or more years should get regular blood glucose checkups. And there are new potential victims of the pandemic, community health clinics that treat underserved and uninsured patients. COVID-19 has created the perfect storm, a spike in demand and faltering funding. Sarah Doloff has the story.
They're needed now more than ever, but clinics that serve the poor and or underinsured are facing increasing pressure from the pandemic.
80% of our clinics are reporting that funding is the #1 issue for them.
For the National Association of Free and Charitable Clinics, demand has skyrocketed at nearly 3/4 of their 1,400 locations, right as donations have dropped nearly 50%.
The worst case scenario is that free and charitable clinics run out of money and they close.
In Utah, 2 state-funded health clinics have closed, and a third may join them due to COVID-19 budget cuts. They served up to 14,000 patients a year, many with chronic conditions and from marginalized populations.
We love our patients. We respect them, and we know that they're dealing with complicated personal and social problems as well as their medical problems. And so we've filled, I think, an important niche in the community.
The Kaiser Family Foundation reports about 28 million patients nationwide are treated every year at community health centers, the majority of whom are low income and racial or ethnic minorities.
They gave me a tray to show me.
Virginia resident Reggie Long credits the Bradley Free Clinic in Roanoke for saving his life during a health crisis.
There's no way I can thank them enough.
That safety net that caught him and millions of others, now less secure for future patients.
A newly released data reveals COVID-19 cases among children have risen dramatically over the past 5 months. According to the American Academy of Pediatrics, less than 3% of coronavirus cases in April were pediatric. But in the last 8 weeks, children made up to 12 to 16% of newly reported cases. The good news, kids typically don't get as sick with coronavirus as adults. In fact, children represent fewer than 2% of hospitalizations in the U.S. and less than 1% of total deaths. Experts say pediatric cases surged in the Northeast and in April and the Midwest in July.